So there was another question about, a lot of us on here are therapists, and we may not have access to neuropsychology or psychologists. So do you have, like, what would be your top 3 things that therapists could do to help these patients? Is there really basic CBT training is one question that was asked.
So when somebody asked that question, I actually did a little quick search, and there are conferences that are PT/OT based that do have speakers that come in and talk about kind of basic CBT principles. There are also like online webinars that kind of talk about it a little bit, and even the Beck Institute offers a course for other disciplines to understand the basics of cognitive behavioral therapy. So I think, you don't want to be a therapist, that kind of therapist, but understanding the importance of how, and you already do this, so it's kind of like rephrasing it. So understanding how to explain to people that emotion affects behavior, affects how you think. So when I have a headache, I think, God, I'll never get over this concussion. I'll never be back to normal. This is terrible. And then the minute I think that, I go eat a bag of potato chips. And then I feel horrible about myself because I don't have any self-control. And well, now I'm going to be overweight and I can't control this. And it's just this spiral of, no matter where you start, the behavior, the emotion or the thought, like we get wrapped up in that. And the goal of CBT is to find a place in multiple places and multiple ways to address that. So I think just having some basic training and just looking for those opportunities in a general therapeutic way.
Shelly, I have an analogous situation to most of physical therapists. I'm not a mental health provider, but I find it my responsibility to try to set the patients up for success. So I think for a physical therapist, the first thing to do is you have to know the material. This is not a topic for dilettantes. So, understand, know all the material about recovery from mild traumatic brain injury and the timeline of what should happen. Second thing is, I think physical therapists and physicians can be helpful in the unlearning process. So ask the patient in their own words to explain to you what the matter with them is, and then help them understand which parts of that may be grounded in fact and which may be belief systems that they can work upon. You do that while continually validating their suffering. And then the third thing you do is know your business, that it is safe to do early activation. It is safe for them to go outside, to do some schoolwork. They're not going to damage their brain more if they read a book. If you want to delve into the world of Jamie and Donna, and they've spent a lot of time getting good at it, I'm careful not to overstep my boundaries. You also have to understand it changes your role. You cannot be a healthcare provider and a therapist. It's 2 different roles. If you want to start exploring those questions, I know everybody says they don't have access to mental health providers. Go find one that knows this. Go find your Jamie or Donna and sit down with them and ask them what you can do to help the patient. They're the experts. So what questions can I ask? What part of CBT would you be comfortable with me doing? And then I know everybody says it's hard to find a mental health provider, but look harder. If your practice is full of these patients, you're not going to get them better by yourself.